Welcome back, everyone. I'm Serge.
And I'm Cern.
And what are we be looking at this time?
So now we're going to move our attention to the umbilical site. This is probably one of the easier sites that we can assess. So we're going to go ahead and look at that. And again, we'll do this in the patient position that they're most comfortable. But for the sake of a demonstration, we are going to place Daisy here in right lateral recumbency so we can look for and answer the questions we will find at that umbilical site.
All right.
Now, one of the big differences between our cats and our dogs when it comes to the umbilical site, we can almost always find the spleen very easily in our canine patients, but our cats, that spleen does move a lot, so we'll just see what we have when we look at that umbilical region. How do we do that? You can either look for the actual umbilical site that we'll often see as a little scar in a lot of our patients, or if you can't find that, you'll sort of go halfway between the subxiphoid site and the urinary bladder. And we'll come in on long axis to start with. And we're going to look to see if we are in lateral for free fluid along that body-dependent region down here towards where my fingertips are. So when we're in lateral, we're going to angle towards that gravity-dependent region to look for free fluid. We can also look for loops of intestine here, just make sure everything looks normal. We'll do that in long axis. We will fan away from the tabletop just to make sure we don't have any pockets of fluid trapped within the omentum or within adhesions. And then we're going to rotate the probe into short axis at this site as well. Again, we'll fan cranial, we'll check the intestines, we'll fan caudal, we'll rock the probe down towards the gravity-dependent region, again with our patient lateral looking for fluid where my fingertips will be. This is different if our patient's standing. I want to come in with gentle pressure, not displacing that fluid, and I want to come in dead center on midline with a probe directed towards the spine if we're looking for fluid in a standing patient. So a little bit of a different technique in long and short axis between our standing and our lateral patients. And in Daisy here, we don't really see the spleen, so we can't see that in all of our cats because the spleen is very mobile in our feline patients, but those are the questions we look for, ask and answer at that umbilical site.
That's right. All right. Well, join us next time for our next site. Merci beaucoup.
Until next time.